Cancer genetics, precision medicine, and patient-centered care are top priorities at the Huntsman Cancer Institute in Salt Lake City, Utah. As part of this commitment, the large NCI-designated institute manages the largest genetics database in the world, with more than 16 million records. Executive Medical Director Dr. John Swedenham explained the institute's focus with the Enclave News Network.
At Huntsman Cancer Institute, we pride ourselves on the fact that we are a very patient-centered organization, and that's reflected in everything that we do, and it's at the core of how we take care of the folks who come here who are affected by cancer. And it really is focus in patient-centric treatment right from the beginning, from the laboratory through to what we do in the clinic. So what I mean by that is that we have developed a strong focus on precision medicine and personalized medicine, not just in terms of predicting who might respond to particular treatments, but in developing genetic screening programs which allow us to focus in a very focused way upon those patients who are most likely to benefit from early screening. So maintaining a very sharp patient-centered approach to the way in which we promote genetic screening. Right on the other end of the spectrum, we have extremely high ratings in terms of our patient satisfaction and the way we actually take care of patients in our clinics and in our hospital. So focusing on the patient experience and making sure that's highly personalized, from the way that patients are greeted by the valet when they actually park their cars here, through what food they choose when they're in the hospital, and the whole experience that they have when they are on their journey through Huntsman Cancer Institute is all part of a very patient-centered approach to what we do here.
The combination of patient-centered care and the world's largest genetics database lends itself to novel and groundbreaking research. Senior Director of Clinical Research, Dr. Sunil Sharma, shared his thoughts on the novel research initiatives at Huntsman.
In short, Huntsman Cancer Institute is an incredible place to conduct research and collaborate with clinicians as well as population geneticists. As the epigenome and the genome of cancer is further unraveled, we strongly believe that Huntsman Cancer Institute will be adequately and well positioned to translate these discoveries from the laboratory and the population side to the clinic and make a significant impact in the lives of our patients.
The Huntsman Cancer Institute continues to explore the genetic basis for cancer, including inherited cancer risk. At the Institute, Dr. Sandra Baez leads the High-Risk Cancer Research Clinics and Studies program, a team of researchers investigating the inheritance, genetics, and behavioral aspects of cancer in at-risk populations.
Huntsman Cancer Institute has really, even before it was the Huntsman Cancer Institute, has been on the ground floor of discovering genes which are important in the genesis of cancer. This started back in the 1990s, and even earlier than that, identifying colon cancer families, breast cancer families, and others. So I think Utah really has had a head start because we've got large populations of people who have provided medical records and genealogies so that we can develop large family pedigrees. These families in general are very interested in participating in research, and we've now been able to take some of those studies into the next level of identifying specific targeted therapies that may be able to be used in these individuals.
Researchers at the Cancer Institute hope to connect genetics with cancer symptom management and the outcomes of supportive care. The co-leader of the Cancer Control and Population Sciences program, Kathy Mooney, describes her thoughts on the connection of genetics with improvements in supportive care.
The Huntsman Cancer Institute is a very important addition to our community and also nationally. One of the unique things about the Huntsman Cancer Institute is its strong studies of genetics and family participation in research. And this goes a long way to make a contribution to learning new treatments, advancing discoveries. One of the things in the genetic studies that have been done here and family participations is it allows us to understand not only how cancer develops because of environmental reasons, but also how genetically it is transmitted among families. And for example, one of the areas that is exciting to study from my own interest in symptom management is what is the gene contribution to how one experiences symptoms. We know, for example, that not everyone experiences symptoms at the same severity. And so one question would be, why does somebody who has overwhelming fatigue and somebody else getting the same treatment has very little fatigue? And so genes may be one of the answers, that there are some gene variants that allow us to have particular problems with certain side effects as opposed to others. And if we could understand that, then we would know before a patient started on treatment for cancer whether they were going to have a difficult time or not, and we could step up our supportive care of them.